Good morning, Susan. My name's Emily, and I'm going to be your nurse today. Can you give me your full name and date of birth, please? Thank you, Miss Cystitis. I'm just going to check your name band. Good. Do you have any allergies to any medications or foods? Very good. Now, I see here that Dr. Disuria has ordered that you get an intermittent catheter, and what that means is it's a catheter that's going to go in and then come right back out. It's not going to stay in there. He just wants to check and see how much residual you have or leftover urine after you go to the bathroom. Since you're already laying in the dorsal recumbent position, I'm going to ask you to pull your feet up to your behind and then just relax your knees and let them fall out. Very good. I'm going to make sure that you stay covered so that you don't feel too exposed while we're doing this, okay? Very good. Good job. Okay. Just going to pull that back so I can see what I'm doing here. Good. Now, what I'm going to do is I'm just going to wipe you off real quick with some cleansing wipes. And then that'll make sure that the area is clean to start with. I'm going to continue to do some more cleaning after this, okay? There's just going to be 3 swipes on this one. Away from me, next to me, and down the meatus. Very good. Okay. Now, I've got my catheter system here. The expiration date on it is 9/30 of 2020. So it's still a good system to use. I'm just going to get all of my supplies ready here, okay? I'm going to put a little drape underneath you. And that's just to keep your bed clean, okay? I just need you to lift up your behind a little bit. Very good. Perfect. Stick that right under there. Good job. Okay. Now I've got my kit right here, whose folds do not like me today. So I'm just going to put on my sterile gloves. This is a sterile procedure, so I want to make sure that everything stays that way, okay? Have you been having pain? Okay. All right. Now I'm just going to get everything ready here. And I have a drape that I'm going to put over you that's just got a little opening here where I need to see. Very good. You're doing a great job. I have iodine swabs. That's what I'm going to use to clean you off. That's why we put the drape underneath you, because these can get a little messy. These can get a lot messy, actually. And then I have a urine specimen kit, but the doctor did not request a urine specimen today. So we're just going to set that off to the side. Here I have lubricating jelly. That's just to lubricate the catheter so it makes it easier to go in, okay? And what I'm going to do is I'm going to put it in the bottom of my tray. And I'm going to lubricate the first 1 to 2 inches of this so that it glides in a lot easier, okay? All right, now I'm going to bring my tray over here to you. Are you still doing okay? Good. If you need to be repositioned or anything, you just let me know, okay? Now I'm just going to spread your labia apart here. And I'm going to pull up a little bit and out so that I can see your meatus. The meatus is the hole where your urine comes out, and that's where I want to be putting the catheter, okay? I'm going to clean on the outside, top to bottom, or front to back. And then I'm going to be cleaning on the closest to me, top to bottom, or front to back. And then I'm going to clean straight down the middle. You just leave that there. Perfect. Good job. All right. Okay. Now, what I'm going to ask you to do is when I'm inserting this catheter, I'm going to ask you to take deep breaths in and out, in through your nose, out through your mouth. You're going to feel some pressure. Okay? And if there's any pain, I want you to tell me so that I can stop, okay? It's not a painful procedure, it's just uncomfortable. So, holding this 2 to 3 inches from the tip, I'm going to insert into the meatus. Okay, here it comes. Now I want you to bear down kind of like you're trying to urinate, okay? You're doing a great job. Going in about 2 to 3 inches. If I feel any resistance, I will stop and then apply slow pressure to see if I get resistance. If I do, I will stop and take it out and try again. All right, I have some urine flow here, very good. So I'm just going to push it in just a little bit more. You're doing great. Okay, good job. Now I'm just going to wait for the urine to stop flowing. Are you doing okay? Very good. All right, looks like your urine's nice and yellow. That's a good sign. And the urine has stopped flowing. Very good. So what I'm going to do is I'm going to take this out now, okay? And it's going to come out not too quickly, but not too slowly. Very good. Good job. Very good. Okay. Now, I'm just going to take this off of you. And I'm going to wipe you up a little bit with this. You did a great, great job. And I'm going to take these off. Cover you back up here. Good job. Okay. Now, you can go ahead and put your legs down and get into the comfortable position. I'll lift the head of your bed up for you. Very good. Now, I'm going to pull your blanket up over you so that I can just pull this right out. Very good. Susan, are you doing okay? I know it's not real fun, but you did a great job. Now, I only got 200 cc's back, it looks like, so that's not too bad. The doctor's going to want to check and see why you've got some left over, but I'm sure he'll be back in to talk with you, okay? All right, I'm just going to document here that I did this and how much return I got, which was the 200 cc's. Do you have any questions for me? All right. Thank you so much, Susan. I'm sure I'll be seeing you again.